Hi, I'm Dr. Deeptee Jain, and I'm a spine surgeon, and I've done thousands of spine surgeries in my career. And a question I often get asked, both by patients but also by other doctors, is who is a candidate for minimally invasive spine surgery and who is not? So before we talk about who's a candidate for minimally invasive spine surgery, we should actually talk about who's a candidate for spine surgery in general, because that is the more important question. There are lots of different factors that go into the surgical decision making about who is a candidate for surgery. So the first thing to think about is the patient needs to have a problem that we know as a spine community gets better with surgery. And believe it or not, there are lots of patients who have back pain. And I look at their MRI and I say, there's lots of non-operative things I can do, but there's no surgery that I can do that I think is going to make that patient better. There are lots of patients, on the contrary, who I look at their MRI and I say, yes, a surgery can definitely take this pain away. I need the patient to be in that second category. In other words, they need to have nerve-related problems. Nerve-related problems respond very well to surgery. They potentially could have some instability or abnormal motion in the spine. That also tends to respond very well to surgery. If they have abnormal alignment, so some patients develop reduced curvature of their low back, and they have an inability to stand up straight. That is called adult spinal deformity. And that is also a condition that we know responds very well to surgery. Patients are very happy after having surgery. That's the first category for deciding whether or not to undergo spine surgery. And that's a decision that's made between the patient and the doctor. The second category is understanding whether or not the patient is healthy enough to undergo spine surgery. Spine surgery is a really big deal. I say it's a bigger deal than getting married. You can take back getting married, but you cannot take back what I do to your spine. Making sure that you understand the risks of spine surgery and that you're able to tolerate those risks are very, very important. So this isn't a black and white conversation, really. It's just a conversation about risks and benefits. So for example, if someone has severe osteoporosis, well, the bones need to be strong enough to withstand the loads if we put a cage in. The bones need to be strong enough to hold the screws. So if someone has osteoporosis, it doesn't mean we can't do spine surgery. The risk of, for example, instrumentation failure is a little bit higher. Patients need to be healthy enough from a medical perspective. So for example, if someone has uncontrolled diabetes, that patient's gonna have a higher risk of, let's say, having an infection after spine surgery. So we wanna do everything we can to mitigate those risks. If a patient's on a blood thinner, that can also be dangerous when doing spine surgery. Patients will often stop their blood thinner before undergoing spine surgery, but bleeding into the spinal canal can cause paralysis. So these are all risks of having spine surgery, and so understanding that can help you decide whether or not you're a candidate for spine surgery. Next, who's a candidate for minimally invasive spine surgery? Well, to me, that more has to do with a lot of different factors. That has to do a lot with anatomy, actually. And so there are certain minimally invasive approaches. I'll give you an example. The lateral interbody fusion. That's a surgery where I come in from the side through an incision about this big, and I put in a cage from the side. Well, a very common condition can happen at L4, L5, and so the patient needs to have anatomy that's appropriate for that procedure. For example, if their psoas muscle, this is an anatomic muscle, is too anterior to the spine, or if there are really important blood vessels that are in the way, then that patient is not a candidate for a lateral interbody fusion. And then we put our thinking caps on and we think about a different type of approach, of which there are other minimally invasive options. So those in general are the main criteria when thinking about being a candidate for spine surgery, being a candidate for minimally invasive spine surgery. I'm Dr. Deeptee Jain, and if you like what you're hearing, hit the like button and also subscribe, and you'll get lots of great information on neck and back pain.